do a short presentation on breast cancer awareness, what's kind of happening in the country at the moment, and then I'm going to go through the signs and symptoms of breast cancer, what you all need to look out for, what's not normal. Then I'm going to show you how to do a proper self-breast check. Juice mannequin. This mannequin actually has breast lumps in it, real simulated breast lumps. So I'm going to get you all to feel them, because honestly, once you feel what a real breast lump feels like, God forbid you ever felt one again, you'd know. You'd know that this isn't right. So who are we? We're a registered charity in the College of Surgeons in Dublin here, and we were established in 2012. Professor Arnie Hill, he's the main breast surgeon out in Beaumont, he set up the charity basically because he was tired day in and day out in the breast clinics, the same thing being said to him by women. I didn't know. I didn't know that this was a symptom, and had I known it was a symptom, I would have come a lot earlier. So he said, we're just going to have to get out there and start educating our women nationwide on being breast cancer aware. So he set up the charity. Also, he's passionate about research. Prior to Breast Cancer Ireland setting up the research centre, there was little or no research on breast cancer being done in the country. That has dramatically changed. Our vision would be to transform breast cancer from often being a fatal disease. Here in Ireland last year, we lost 690 women died from breast cancer. Now, a small number, that 690, may not have survived because they came very late with a highly aggressive form of breast cancer, but sadly a large number, that 690, may have survived. Had they only come earlier, had they only been detected earlier, they may have survived. When we say we want to change breast cancer to being a treatable long-term illness, that's the vision worldwide at the moment. In the not too distant future, the vision would be that breast cancer would be like having high cholesterol or having high blood pressure. You'd be diagnosed, you'd be put on a combination of drugs, you'll stay on them for life, but you'd be breast cancer free, and that's the vision and that's our hope in the future. Our mission is to speed up all this. If you're not doing research, everybody knows you're not getting answers, and that's not good for the outcome of women. And to provide education and awareness like I'm here today, when we're not doing the coffee and learn or the lunch and learn in the workplace, we're heavily involved now in two programmes. A transition year girls programme. So this basically is what we do, is we go into TY, transition year students. We deliver a programme similar to this, and what we're trying to do, the aim of this programme is we're trying to switch on a switch at 16 here in Ireland with the girls, that it's the most perfectly normal thing to do. You get your period, you check your breasts. And if they start this now at 16 and just carry it forward into the 20s and 30s and onwards, without a shadow of a doubt we'll save lives, because girls will just be breast cancer aware. It's going really well. We started another programme in just the first of the month in October, a primary school teachers programme. So basically in Ireland, the age profile for primary school teachers, it's mainly female. I think it's nearly up to 90% are female. It's 24 to 60, that's the age profile. An ideal age group to get, because you get them all together. So we started that, and we're going to be doing that over a 5-year period, and we'll have visited every primary school in the country and given the programme. How we do all this, so if you don't know the system or you haven't been in contact with the breast care system in Ireland, it's very simple. There's 8 centres of excellence in the country. Really lucky, there's 4 in Dublin. You have Waterford, Cork, Galway, and a satellite one up in Donegal. So basically, girls, what these are one-stop shops. You go to your GP if you find anything, that's your first port of call, and then every GP now in the country has a fast-track system into the nearest centre of excellence to your locality. So I can only speak for Beaumont because we're affiliated with there, but in Beaumont we see women, an urgent request from a GP, our mandate is to see women within 10 days. We actually try and see them within a week, because that's the longest week of your life waiting on that appointment. Probably the same in most of the centres of excellence. 10 days is probably the call. If it's obviously not urgent, you'll be a lot longer. But hand on my heart, I'd say the breast care system in Ireland is working really well. It's really good. You'll always hear things, you know, always in all systems, but I'd honestly say it's working really well. So what we're doing in these centres, we're funding research nurses. There's a mixture of fellas and girls doing it. So basically what they do is they'll visit the lady just before she's going to have her breast removed, a mastectomy, or the lump removed, a lumpectomy, and they'll ask would she donate her tumour, and 100% of women say yes, absolutely. So what we're doing is we're banking these samples in what we call a biosource unit. It's between the College of Surgeons and Beaumont. So basically what it means is last year we banked 2,890 breast cancer samples. That means there's 2,890 samples available for research. It's phenomenal, coming from nothing. The country was doing little or nothing. It means now any clinician in the country who wants to avail and do some pioneering research can avail of these samples. And we're funding the nurses who are doing the data. A couple of things going on you may not know about. There's a very sophisticated test now called the Oncotype DX. It says blood there, but it's a tissue test. The government are paying for every woman who comes with early detection breast cancer. It's simple. What they do is they take a sample of your breast tissue, the tumour, they send it to the States. It takes 2 weeks to come back. But when it comes back to whatever breast care team you've been assigned to in whatever centre of excellence you're attending, and it basically tells them how you should be treated. It's a personalised portfolio of your actual cancer. It tells them whether chemo is going to work or not, and if not, what will. And then, more importantly, it gives a scoring to the team that the likelihood that your breast cancer is going to return. So you're scored at a low, medium or a high risk. So now you can be treated accordingly to that. So basically before the Oncotype DX was on board, it was almost like a one-size-fits-all. This now establishes your personal breast cancer and how you should be treated. We're now seeing 50% less women getting chemo in early detection. And what I mean, girls, by early detection is there's two types of breast cancer, invasive and non-invasive. So non-invasive breast cancer is breast cancer contained all together within the breast. Invasive is where some of the cells from the original have broken away, and you've all heard of people having lymph glands removed under their arm. I don't know whether you remember biology from school. I won't question you on it, but your lymph system backs up your blood system. Some of the cells break away from the original, travel in under the arm to the lymph glands. That's invasive. It's gone from one place and moved into somewhere else. Still 100% treatable and fixable. It's just the Oncotype can't be used in that because it's left the original area. There is a new one coming on board, and it'll be very, very soon, in the next year or two, a more sophisticated test of the Oncotype, which will allow for some lymph node involvement. So things are advancing. I'd honestly say breast cancer is very treatable and very fixable. There's only one secret to it: you get it early. You detect it early, your journey is far lesser journey. A couple of things else going on. There's international drug trial going on in Beaumont at the moment. There's 21 women on it, and to date 11 are totally cancer free. Worldwide there's 5 major drug companies now working on breast cancer drugs. As I said, it's very positive, and the outlook is very positive. The message time and time and time again is get it early. Just detect it early. We invest in state-of-the-art equipment. So this machine is in Beaumont Hospital. It's the only one in the country. What it is so if you require chemotherapy, that's the drug treatment for breast cancer. If you require radiotherapy, that's the deep X-ray treatment. There's a minimum for radiotherapy of 5 weeks. That's the minimum treatment. We don't know how lucky we are. Most of us here are probably within 40 minutes, an hour to the nearest centre of excellence, because there's 4 of them in Dublin. But the women in the border counties, the Donegals, the Sligos, the Mayos, the Cavans, the High Cavans, they could be on the road at 4 and 5, 6 in the morning down to the nearest centre of excellence, which may be Beaumont. And they do that for 5 weeks, and they'll do it consecutively. It needs to be consecutively. You have to go Monday to Friday for the 5 weeks. What this machine does is, so it extends the operating time by about 40 minutes. So a surgeon has removed the lump or the breast, whichever he has done there. A radiographer and radiologist come in with the machine. This arm here, there's an arm there, and there's a little ball on the end of it, drops down into the cavity where the breast or the lump has been removed, and it gives one single dose of radiation. That single dose of radiation is equivalent to 5 weeks. Lady stays overnight to be observed, but she goes home to recover. It's only on a pilot scheme, And by what I mean by that, it's only used if you meet the criteria, and the major criteria for the machine is very early detection, where the breast cancer is contained. It's only used on a certain cohort of patients. This and the Oncotype DX will be offered to you if you are a candidate for it. You don't have to go looking for it. If you're a candidate, you'll be offered. As I said, it's the only one in the country, and it will speed up, it speeds up recovery time. You know, you go home to recover rather than have that 5-week journey. This is the TY program. So we sold to them as breast health girls is your wealth, meaning if they have good breast health now at 16, it's their wealth for their future. As I said, it's been really well received, and back 3 years ago when we launched the program, I was knocking on doors trying to get into schools. Don't even have to look now. They're coming back year on year and say, can we do this program again, which is amazing. It's fantastic. So a few stats: 3,141 women diagnosed here in Ireland last year with breast cancer. 1 in 9 of us may be affected in our lifetime. We might, in the room here, girls and boys, we may not be that 1 in 9, but without a shadow of a doubt we'll know somebody. 100% sure you'll know somebody. 30% women being diagnosed now between the ages of 20 and 50. In fact, 15%, and this really, to a profile of you girls here in the room, is a really important figure. 15% of women now we're seeing between 20 and 40. That's a huge increase. That was 5%. That has risen dramatically to 15%. So we're seeing a marked increase in girls between the ages of 20 and 40. You'll ask why? They're attributing a certain type of breast cancer we're seeing in the younger woman to lifestyle. Heavy consumption of alcohol, smoking, and generally just being unhealthy. The biggest risk, the fact that you're a woman, is your highest risk for breast cancer. For the males in the room, men do get breast cancer, 1% of the male population, very, very low. But for the girls to keep this in mind too, for anyone with sons or male partners going forward, the symptoms I go through with you today for yourself are exactly the same in a male. All men have breast tissue. 1% is very low, very, very low, but it's very difficult because the men attend the breast care system. It's not that anything different. You come into the clinics with the women, you know, there could be 49 women and 1 man in a clinic. It's very, very difficult, but just to bear that in mind, everyone, the symptoms are exactly the same. So progress in the country is certainly being made. 75% of our women were surviving breast cancer. We've now gone up to 85%. We're going in the right direction, we're going that way, but we're still behind Europe. We're still behind Scandinavian countries, the UK. Some of the Scandinavian countries are as high as 93 to 94% of their women survive breast cancer. We're all doing the same thing. There's only one thing that we know for sure, is that Irish women don't self-breast check. And that's we're pretty sure of that. So we don't detect as early. And this is why the TY program and the schools program and all, we're just trying to get that message out there that if you actually do a self-monthly breast check, without a shadow of a doubt, you're going to pick up something early. 50% less chemo being given because that new test, the Oncotype DX, and the trials going on in Beaumont and the state-of-the-art equipment in Beaumont. So back in 3 years ago when we launched the program, Katie Taylor launched it for us, and she said her hands saved her, meaning her face. Your hands could save you, meaning we're going to get your holiday photos now, are we?
Yeah, something is coming up, I feel it.
Read all your emails. I keep talking, they might notice. Yeah. So we launched an app called Breast Aware. It's really simple, it's free. You download it to your phone. Offers you 2 options. First option is a calendar, and second option a clock. You set the calendar for the week after your period. If you're not getting a period or on contraceptives that are 3 monthly or whatever, pick the same day every month. Just pick one day the same every month. And then on the clock you put in about 10-15 minutes before you'd normally shower. And all the app does every month is send you a reminder, and it works because it plays with your head. First month you get it, you sort of go, yeah, I will do that tomorrow. You probably don't. Second month, nearly the same. I think it takes about 3 months. By the time the third one comes in and you think to yourself, I better start doing this, that's 3 months. And if there was anything, you know, I haven't done it for 3 months. The only reason we as women are reluctant to self-breast check properly is fear. and no other reason. You're just afraid of your life. If I look, I might find. If I don't look, I won't. Fear leaves you with the app because your head tells you, I did this 4 weeks ago, there was nothing, it was normal. If I find something now, it wasn't there 4 weeks ago. And that's where you become very comfortable, because you just become very comfortable. That fear factor's gone. It's the not doing it. It's not doing it and maybe 6 months or 6 months and finding something. That's when you freak, because you say, how long has that been there? When did I last look? I can't remember. So it just sends a reminder. I always say to everyone in the workplace, don't set the clock for 12 o'clock here, you clear the building. You know, at home, 10 minutes before you'd normally shower. Anyway.
We lost it.
Sleeping? Okay. So I'm going to hand you over to Ger now. Ger's Collins is our patient ambassador, and she's going to talk you through her journey. That's Ger.
Hi everybody, my name is,
no, I'll do the thing for
is Ger Collins, and my role here today is to totally reinforce everything that Adrienne has said about early detection being survival, about the importance of self-checking and the importance of getting to know what's your norm. My story starts 4 years ago when I found a lump in my breast while I was doing a routine self-check. I knew it wasn't there before, and I knew it wasn't my norm. I start with this picture. This was me a week before I was diagnosed with breast cancer. So I would never have known I had cancer because I had no other symptom at all. I wasn't tired, I wasn't off my food, I wasn't losing weight. I had no other symptoms of cancer besides the lump. So if I hadn't found the lump, I would never have known, and I certainly wouldn't be standing here as well as I am today talking to you. So I went to Beaumont Hospital and I had my triple assessment done, which is a mammogram with an ultrasound and a biopsy. So there and then they told me it was suspicious, they knew it wasn't good. So I suppose that's the moment you realise, oh my God, my life is now about to change. There was a lovely nurse there and she just smiled at me and asked me, was I okay? And I remember saying to her, put it this way, I would give anything to be at home and do my ironing now, because I knew that everything was about to change. I have 3 boys, they were 8, 10 and 12 at the time. So my 8-year-old was due to make his communion the following year, and I remember thinking, oh my God, I've ruined Brian's day. I'm going to be dead, or I'm going to be so sick. So the hardest part about a cancer diagnosis is the not knowing. It's the waiting for the results, because your brain goes into overdrive and you have yourself dead and buried. So it's really the hardest time. Once you find out what your treatment plan is, it's easier to face it. So a week later I came back and Professor Arnold Hill confirmed that I did have a cancerous tumour, and I just asked him straight out, was I dying? And he said, you're not dying, you're treatable and fixable, but it's a year out of your life. So once I knew I wasn't dying, I decided whatever I have to face, I'll face it. So my treatment plan was a mastectomy, so a full removal of my left breast. So I didn't have reconstruction, I just wear a prosthesis in my bra here, and my kids hide my boob on me, and I'm going around saying, where's my boob around the house? And one of them used it as a little pillow one day to snuggle into it. And so I had 6 weeks to recover from that, and then I had 16 sessions of chemotherapy over 20 weeks, followed by 33 sessions of radiotherapy. So I suppose with us it was about being open and honest with our kids. Once I knew exactly what we were dealing with, we described it as being a good cancer, and that I was very lucky that I got a good cancer. And our mantra for the year was, this is temporary. This was not something that was going to go on. It was a temporary blip in our family life. So I suppose the minute you hear about chemotherapy, your first thought is your hair falling out, and you just think it's the worst thing in the world, the thoughts of your hair falling out. On day 15 after your first chemo session, your hair comes out in such clumps that you actually can't wait to get rid of it. So I often think it's Mother Nature helping you to just do it. So my 8-year-old son at the time always shaves his dad's head. So I had said to him, you know, would you shave my hair? I just wanted them to be involved in a kind of an open way. So he said he would. So he shaved my head and designed loads of mohawk shapes and designs on my head, and was having great crack shaving it off for me. And my middle guy was 10 at the time, and from the very first day that I told him I had cancer, he had promised me that he would shave his head with me. So this is him after he shaved his head and I had shaved my head. And my eldest son, who was 12, was the photographer in charge that day and that evening. And And then I always say, we went downstairs and had dinner afterwards, because life goes on. Even if you've just shaved your mum's head, those 3 boys still needed to be fed. You know, they learnt a lot over the year as well. My friend was diagnosed after me, and I said to Brian, have you any advice for dervless kids now that you've gone through it? And he said, just say to them, look, your mum is going to lose her hair, but she's still the same mammy on the inside. So, you know, as an 8-year-old, it was a very deep thing to come out with. This is how you get chemo intravenously in through your veins. I used to go to the Bonds in Glasnevin at around 9:30 in the morning, and I'd be home by 1 o'clock. I didn't mind losing my hair. I did mind losing my eyebrows and eyelashes, because that screams cancer. But I did buy a wig, but it has seen more Christmas plays and fancy dress parties with my boys than I didn't wear it. I just wore hats because it was winter time anyway. Lots of advantages to having no hair. Showers are very quick and you never have a bad hair day. So it's funny, people don't talk about it. It's the growing back of your hair. It's actually the hardest bit. It's the not being the waiting for your hair to grow back and get some kind of a style in it. Again, the therapies and treatments have improved so much now with chemo. I was never sick. There's all these anti-sickness drugs that they give you that they really don't want you to be unwell when you're getting chemo. The worst 2 side effects for me were watery eyes and very sore nails. So again, going into chemo, they are just angels in there. You know, the nurses and the staff are all so kind, and it's all that kindness that you're exposed to that actually does help you get through it. This is how you get radiotherapy then. You must lie flat and hold that bar at the back of your head. You can't move. So I spent the 33 sessions panicking, thinking what would happen if you started to sneeze. And it's very cold, it's very clinical, the room is very cold, the machine has to be kept at a certain temperature. You're alone in the room because obviously nobody can be in there with you. So it's a different setup from chemotherapy. The worst side effects of radiotherapy are burning of your skin. So I had a big red square on my chest and a smaller one on my back for the exit wounds. Without a shadow of a doubt, it was my family and friends that got me through the difficult times. Like everything in life, when you're faced with something, it's your support network. These are my mad bunch of friends from Donabate who had a boob party for me before I had my mastectomy. So all cakes and buns were made in the shape of boobs. There's melons with cherries on the top there, and pita breads with olives to cater for all shapes and sizes. But again, it was just to get people to talk about being breast aware. I don't drink, I don't smoke, I'm a healthy weight, I'm fit, and I breastfed my 3 boys for over a year each, and I still got breast cancer. And I think that's what frightened everybody, was the fact that I would get breast cancer, you know. So again, it was just to get everybody talking about being breast aware and the importance of doing self-checking. Every week, 2 of my friends would come to chemo with me, first of all to take away the mystery of how you actually get chemo, but also for them to see that at 43 I was the oldest getting treatment in the Bonds, that all the other girls were younger than me. One girl had just had a baby, so she had a 3-year-old newborn baby and was going through chemo. So again, I just wanted to expose the girls to the reality of what's going on out there. They set up a WhatsApp group for me. They cooked dinners for me every Friday when I'd come home. I'd never have to cook a dinner after having chemo. And again, as Adrian said, you know, 1 in 9, hopefully you're not that one, but you most certainly will know somebody. And it's about being there with them. You know, send the card, send the text message. It does make such a difference to the person, you know. This is us 3 weeks later after I had finished radiotherapy. We ran the mini marathon for Breast Cancer Ireland. The one word I always use about life after cancer is gratitude. And I was so grateful that Breast Cancer Ireland was there and all this research was going on in the background. Again, you don't realise it until you're in the situation of how much you need it. My cancer was an estrogen-fed cancer, so my estrogen levels in my body were feeding it. So I'm now on a tablet for 10 years called Protopic, or not tamoxifen. Oh my God, where did I get that word from? Tamoxifen, and it's to decrease the estrogen levels in my body. So should my cancer come back, my body doesn't feed it. These are all therapies and treatments that are offered to women now that were never offered to women years ago. So again, we're so grateful for all the research that's going on behind the scenes. I spoke earlier about my son's communion, so this was us 8 months later. Not the hairstyle I ever thought I'd have, but it was one less job to have to worry about that morning. But again, just being so grateful to be there and just really making the most of the day, you know. I mean, some of my friends were talking about sugar soap and their walls and the house and getting everything ready, and I'm looking at them going, are you mad? You're here. This is all that really matters in life. So, you know, a cancer diagnosis does make you realise what's important in life, you know. I suppose people commented on my positive attitude while I was going through treatment. It is all about which way you look, no matter what you're faced with in life. The phrase, you don't know how strong you are until being strong is your only option, is so true. I had 3 boys that I had to look after. There was no way that I was going to lie down and take this. So, you know, there's a phrase that says everybody has 2 lives. Your second life begins the moment you think your first is over. And that's so true for a cancer diagnosis. But I'm also here to show that there is life after cancer. You know, the secret is to catch it early. You know, I was lucky enough to have caught it early and to have known that this was not my norm, and that's why I reacted. You can't control whether you get breast cancer or not, but you can control how quickly you catch it. And that's what this programme here today is about, to teach you the signs and symptoms so that you are now aware and that you can control it. So that's my story, and thanks for listening. Thank you.
So, thanks, Chair. That's signs and symptoms of breast cancer, what you need to look out for, what's not normal. But the first thing I'll say to you all is, which is really important, is you need to know your own norm. So know what's normal for you. Because if you know what's normal for you, in the event there's a change, you'll spot it. We'd recommend something we don't do, but every now and again get into the habit of looking at yourself in the mirror. Strip to your waist, put your hands behind your head like that, cupped. Hands on your hips and hands down by your side. When you lift your arms up behind your head, your breast tissue comes up with you. So visually, just have a look. So what are you looking for that's not normal? There's 8 red flags, we'd say, that aren't normal. One breast enlarging significantly bigger than the other. Now, almost swelling. Bear in mind, most women have one a little bit bigger or a little bit lower, but get to know that that's your normal. And this is significant swelling. Or one of your breasts starting to drop down below the other. So the 2 nipples are no longer across from each other. One nipple is significantly lower. What's happening there is the weight of the cancer cells are pulling the breast downwards. On the nipples, there's 3 things to look out for. A sudden inversion of a nipple. That's a nipple previously been out going in. Loads of women have naturally inverted nipples. That's fine. Know that that's your norm. But a nipple that's been out and reverts back in is something you would need to check. Bleeding from the tip of the nipple, we see that more in a more mature lady. It's a certain type of breast cancer. But any fluid, girls, coming out of a nipple outside of breastfeeding isn't normal. So you would check it out. Any change in the brown area around the nipple in size or colour. John, can you see at the back? We'll improvise. Stick her up a bit higher. Get your markers. That better? Any in the brown area around the nipple, any change in colour and size. There's a very distinctive rash that occurs in the brown area, and you'd honestly know it wasn't normal. It's a crusty, the only way I describe it when you see it is a dirty looking rash, a crusty rash that occurs around that area. On the skin of the breast, there's 2 rashes to watch out for, to look out for. First rash, it's called pot orange in medical terms. It literally looks like the skin of an orange, and when you run your fingers over it, the texture feels like an orange. It's flesh coloured. Second rash is called an inflammation rash. You won't see it from the distance, you'll see it when I bring it down to you. If I got a red pen now, just a biro, and I drew a cluster of red dots, that's the inflammation rash. The inflammation rash and the orange peel rash, the one distinguishing thing about them, they'll always be patched. They'll be in an area localised, because what's causing the rash are the breast cancer cells beneath the skin. So wherever the cancer is activating is the rash. It wouldn't be all over. You know, it's perfect. It's quite normal to get sweat rashes here. They'll always be patched somewhere on the breast tissue. And a really important note for you all, where you actually have breast tissue, it starts right in under your arm. Do you see where the collarbone is? If you find your own collarbone and put 1 finger below it, that's how high up your breast tissue goes. 1 finger below your collarbone. The majority of women honestly think that breast tissue is just the blob-a-boo here. Breast tissue starts right in under your arm, up under your collarbone. So think of bone to bone, down the side of your breastbone and back in around again, right in under your arm. In fact, after theatre, when you see a breast, it's got like a teardrop shape. So you have it here and then the tail in underneath the breast. Really important visually when you're looking, and then tactically when you're examining, that you cover that whole area. Very last thing on the skin is a dimple. You know a dimple on a face? exactly the same, and quite a common one. And also a recommendation if you're very big breasted, that when you are visually looking, lift them up, that you look underneath. Do you ever get a sore throat and you get 2 golf balls here? They're your lymph glands. They're roundy, they're shiny, you can move them about, they're quite symmetrical. Very, very different from a breast lump. Breast lumps in general don't move. They're in general uneven to the touch. You know when you feel what I mean. There's always an unevenness about them. Hard lump under your arm, you can get it for other things, but that goes down very quickly. Hard lump under your arm that doesn't go away is something, lymph gland enlargement, that you will be checking out. How do you breast check? We would recommend the shower. It's the easiest and the simplest method. Now some women prefer to do it lying on the bed, lying down. That's fine if that's your preference, but the easiest is the shower. You put your thumb on the nail of your little finger like that, so you get a bit of a bounce. Shower gel on those pads on the top of the 3 fingers. Right hand up for the right breast behind your head, left hand up for the left side. You start right in under your arm and you go in an outer circle up under that collarbone. But the most important things, folks, is the really important is you need to push in. This will find nothing. And you know, girls say, oh, I put body lotion on every day. Body lotion, tan, nothing will find something unless you push in. So you go in an outer circle, but you're pushing in, back in under that arm, right in under the arm again, a lesser circle, a lesser circle. So what you're basically doing is covering the whole breast in circles. So start right in under the arm, up under that collarbone, back in, around, 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 until you get back to the nipple. You switch around, left hand, shower gel again, and you do exactly the same. Easiest method is to conditioner in your hair. Conditioner's cooking, you have a job to do. Done. If you've never done it or reluctantly done a breast check, you probably think you're going to find loads of things. You won't. Breast tissue is very normal. And as the months go on, if you do, and I hope you do, start doing a self-monthly breast check, you become very comfortable. You know. A lot of women have lumpy breasts, but you need to know your lumps. So what you're looking for all the time is something that wasn't there before, or something that has changed. And the whole message is act on it. Don't leave it, hope it'll go away. Just check it out. So I'm going to bring the mannequin down now for you all to feel. 3 lumps, girls and boys, in this. First lump, size of a pea or a popcorn kernel. Very, very, the note I would say on it is you would never find this unless you were actually looking for it, unless you were actually doing a self-breast check. Second lump, a bit softer, but what tells you that it's not right, there's a softer feel to it, is there's an edge on it, and I want you to feel that edge.